Vijay is going to discuss about the taking care of oneself during winters and tips to boost immunity.
Good evening, friends. Thank you so much for joining us, and thank you to Apollo Clinic for giving me this opportunity. Today, the topic is winter care and tips to boost the immunity. So, what exactly is your immune system? Immune system is a very beautiful and complex system of uh, proteins and enzymes and cells that take care of our body and protect it against the daily onslaught of viruses, bacteria, chemicals, and other pathogens. So, what does your immune system basically consist of? It starts from the skin and the mucous membrane of your mouth and the throat, and also the esophagus and the stomach. And then comes the tissues or the lymphoid tissues like the tonsils, the adenoids, the lymphoid tissues around the tongue. And then is the acid. The acid secretion in the stomach is also protecting you. It protects the tissues from it destroys the viruses and the pathogens that are not supposed to enter your body. And then even if it crosses this barrier, then there are the lymphoid tissues in the intestine called the Peyer's patches. And these also, if even the pathogen is able to cross this barrier, then it enters into the bloodstream, and then you have the white blood cells that come into action. The white blood cells are, of course, basically the neutrophils and the lymphocytes. There are other eosinophils also, monocytes, basophils, which protect you from the onslaught of these pathogens. Each blood cell has its own role. The neutrophils take care of the bacterial infections, and the lymphocytes are responsible for producing antibodies against the viruses and other antigens that onslaught your body. So important in this is, of course, the lymphocytes, which there are two types. One is the B lymphocytes and the other is the T lymphocyte. The B lymphocyte is the lymphocyte that creates the antibodies, and the T lymphocytes is responsible for the long-term memory of your that your body has been invaded for this infection in the past, and at any point if this infection comes again, it is responsible for immediately coming into action. After that is the lymphatic system. The lymphatic system is what drains all the products of the inflammatory process that occurs, and it goes to the lymph glands. Lymph glands are tiny bean-shaped glands situated in your neck, axilla, thorax, abdomen, groin, and also in the legs. And these are basically like your police stations. They try to control the infection in that particular region itself so that it doesn't spread to the other regions. And then what happens is you have the other systems also that are played there. There are cytokines, there are other inflammatory markers that come, and eventually all these cells and tissues are destroyed in the spleen. So the spleen again is a very important part of your immunity. So this is such a complex and beautiful system that works without our knowledge and is protecting us 24/7. So to boost this immune system, we need to do certain things, and it needs a certain amount of nutrition, a proper diet. So what is important for this immune system to function well? You need a very balanced diet, which should include both macro and micronutrients. The macronutrients, of course, are proteins, lipids as in fats, omega fatty acids, and also vitamins such as vitamin A. Vitamin A is very important for the epithelial integrity of your skin, and of course for the mucous membrane in your mouth. And then vitamin D. Vitamin D is very important for the functioning of these lymphocytes. And vitamin E, and also all the B vitamins, which are they play their own role for the small enzymes to act so that the lymphocytes and the cells function well. Also, you have mechanisms in your body like your sneezing mechanism. Whether you believe it or not, the sneezing is also part of your immune system. It expels the allergen from even entering the body. The hair cells are very important to they act as a filtering mechanism. and also the mucus that is secreted by the gut, the fat that is secreted by your skin. Everything plays its own role in protecting our body from the daily onslaught that we face. So it is so complex and so beautiful. So how does this immune system develop? The immune system is in a very immature stage in children and in newborns, and they do get a lot of immunity from the mother, as in the antibodies that are there in the placental crossover, and also from the mother's milk. The immune system is very immature in children and in young adults and teenagers, and gradually matures over a period of time, and it reaches its optimum peak in late adolescence and the young adult. And gradually over a period of time, as we age, the immune system also starts to deteriorate. Immunity is also active and passive. Passive immunity is where the role of vaccines also are important. The active immunity that is inherent in us. Another important thing about the immune system is the day-to-day activities that we do also affect the immune system. Like if we sleep well, we have a good exercise, if we have low stress levels, our immune system is able to function better. So all these are important factors for us to boost our immune system. And the next part of the topic is our winter care. So winter is a good season in southern part of India. We enjoy the winters here, but winter also brings with it its own problems of increase in upper respiratory infections and also the flu season, so-called flu season. So why is it that the flu is more common during the winter season? To answer this question, there is basically what happens during the winter is that the season becomes very dry and the humidity level also falls. So in this time what happens is the viruses are able to live longer in the environment. So when they are able to live longer in the environment, they can easily infect the others. In a hot, humid condition, the viruses are not able to live as long and the chance of infectivity is less. Also, what happens during the winter months is there is crowding. People tend to stay inside, they are not going outside, and then there is easy transmission of any infections, especially the flu virus is able to transmit from one person to another. Also, what happens is we are indoors, we are not exercising as much. There is also lack of vitamin D, and this also makes us prone to all sorts of upper respiratory infections. Another important thing is we are also eating a lot, maybe. So we are sitting indoors, especially in the European and Western hemisphere, they're inside, they're eating junk food, they're not exercising. So that also makes them very prone for all this sort of infections. So what should we do to take care of ourselves during the winter months? So first of all is your skin. To take care of the skin, what is important is to have good hydration, good moisturization. So hydration, we should drink enough water, and also we should have good moisturizer. And also what many of the dermatologists recommend is even during the winter months to use a good sunscreen so that there is not skin damage does not occur. Also, we should during the night and in the morning gargle your throat, especially after a meal. So you have a good gargle so that any bacteria or any pathogens that are sticking to the tonsil or the lymphoid tissues get washed away. Best and very simple thing is warm hot salt water. So this kind of flushes it off, and also the salt destroys the cell lining of the viruses and the bacteria, and it relatively makes us, the pathogen load gets reduced. Very important thing for children and also for adults is to inculcate the habit of brushing twice a day. Why is it important? Because when we brush at night, the pathogen load reduces. So there are studies that show that if for children who brush twice a day, the risk of upper respiratory infections reduces by 30%. So what else can we do? We can also take a lot of warm fluids. Don't take cold things. You take a lot of soups and healthy nutritional diet, good seasonal vegetables and fruits. Especially this is a good time to fill your diet with lot of nuts which are filled with minerals and other fatty acids, which are good fatty acids, which are good for the immunity. And then you have good breathing exercises. Breathing exercises are also very important. Breathing exercises help to increase the lung capacity, so that in case tomorrow if you have any infections, you're able to have the reserve for your lungs to fight and overcome those infections. Also, steaming is very important. What does steaming do? Steaming and the way it should be done. Steaming is very important because it loosens the mucus. And how should it be done? Many people believe that if you steam for hours or several minutes, that is when they're getting the benefits. That is not true. You should actually just steam for a couple of minutes with just plain hot water. That is what is the optimum window where it is very effective. And it doesn't, if you steam for a longer time, what happens is, you could end up damaging the hair cells, hair that are important to clear off the mucus. So you can do frequent steaming, but do it only for 1 to 2 minutes. Also, when the steam hits your nose and nasal passages, there are structures on the sides of the nose called turbinates. These shrink and this allow the mucus secretions or whatever is secreted or collected in your sinuses to drain out. Other winter tips would be to avoid smoking, excessive alcohol, good sleep. Sleep is very important, and to have sleep is very important to maintain a good immunity anytime, but also in the winters, so that you have the immunity is built up. Sleep is important because it is very important for the body to rest and to reduce the stress levels and the stress hormones in the body. So sleep is very important, and exercise. Exercise is usually, of course, in European countries where it snows, they're homebound and they're not able to go out and exercise at all. In that cases, of course, this may not happen in our part of the country, but in certain northern areas where it is cold and they're not able to get outside, so you can try to do some amount of exercise, like a brisk activity inside the house, or just kind of getting up and do some body weight training, so that your body is stretching enough and your joints are functioning well and your muscle tone is maintained. Also, what happens during the winter months is it's a problem of isolation. They're inside, they're always confined, and there is an element that there is called as seasonal depressive disorders can happen. So these are also can be addressed by maintaining good interpersonal relationships between the family, and in case you're isolated away from the family, to use technology to kind of connect with people who boost your morale and keep you happy, because it is seen that chronic stress also plays a very important role in damaging the immune system, and a stress-free environment and a calm mind also will help to boost your immunity. So inculcating habits which make you happy, good hobbies, or gardening, or dancing, or yoga, or meditation, whatever kind of keeps you calm and reduces the chronic stress levels, also help in boosting the immunity. So I hope I've been helpful in addressing some and giving you some tips with regard to managing the winter and taking care of yourself in the winter. And during the winter months, if you can take care, basically hydration, diet, breathing, and good exercise, and good sleep, and good interpersonal relationship with your society and friends, so that you have a wholesome, healthy, and proper life, so that you are less prone to all these infections. Any questions, I'll be happy to answer.
Thank you, doctor. You have shared your valuable information, and I have prepared some questions to ask you on this special session. Shall I go with that, doctor?
Oh, please, pleasure.
Yeah. What are the best tips to strengthen our immune system in this winter season, doctor?
Yes, actually, winter season is a time when there is, as I said, there is a lot of, not only, of course, now we are living in the time of COVID, but even earlier, there was this flu season. Winter was known as the flu season. So, the normal healthy person will not have, they will be able to come in and out of the, the flu, but the extremes of age, they are more susceptible. So as I said, they should take good warm fluids, avoid cold things, and then have a very healthy diet, which should include all different types of minerals, including you have your macronutrients and your micronutrients, vitamins and minerals, zinc, vitamin C, include lot of fresh fruits and vegetables, and also nuts, and have a complete variety of a good diet, a varied diet, and there's a concept called a rainbow diet. So what is a rainbow diet? Is to take fruits and vegetables of different colors. So if you're having a brinjal, have a grape or banana. So all different, what these color nutrients are because of different, the colors are because of the different micronutrients that are in the food. So like tomatoes have, they have certain compounds which are helping to improve your immunity and the functioning of the immune system. You can include garlic. Now turmeric is a very important, it's coming to the forefront all over the world. So garlic, tomatoes, turmeric. So these are very important. Nuts, walnuts, almonds. So these berries, these are very important to help in improving your immunity. Good sleep and good exercise, these also help. And during the winter, the dryness is another important thing that happens. So dryness, the dry skin makes it scaly, and then you have aberrations. So try to moisturize. So drink plenty of water. Sometimes we don't feel thirsty during the winter. And so we should take enough water and keep the skin from drying out, so that you don't feel scratching, and you don't feel itchy, and you don't get any kind of, there's no damage to your skin, because that is the first barrier. So I hope I have answered.
Yeah, right, doctor. Yes. So, how to take care of chronic disease patient in this winter season, doctor?
Yes, very important question. Chronic disease patients like diabetes, kidney problems, cancers, autoimmune disorders, so transplant patients. So these patients are prone to a lot of infections, and they are recommended that they take the flu shots. Yes. So that is recommended by their asthma. So these are chronic disorders that we face. Patients with these kind of patients, it's better they take their flu shots well in before the winter starts actually. Okay. It's not when winter starts you're supposed to take it. They should ask their physician, and they should take it at least maybe by September or October, before the season starts, so that there is enough time for the immunity the antibodies to form, and they are immune to for any kind of flus or any kind of viral problems that come.
Okay.
And also, again, for them also, it is very important that they kind of maintain their immunity, take care of their problems. Say a person is diabetic, so he is supposed to take his medicines on time, maintain his blood sugars well. And suppose a person is on other medication, they're supposed to take their medication, follow the advice as per their problem, so that they can be, their system is fit enough to face the onslaughts. Okay. So it's nothing to be afraid if they are chronically ill, as long as they kind of follow what they're supposed to follow. So that will help them to tide over the winter.
Okay, doctor. Is it mandatory to take flu vaccine during this winter season, doctor?
Yes, that is it's a very important question, which is on top of most people's mind. Generally, what we were doing in the past is, as I said, chronic disease patients were definitely advised to take the flu shots, and timing also, early October, so that they are ready for the winter. But now I think there is a change. Even normal patients are advised to take the flu shots, so that there is no flu, and sometimes the flu and COVID symptoms overlap. So even now, even the normal people are being advised to take it, so that at least we know that it is not COVID. Okay. And so that they in case they develop, so at least they don't develop COVID. I mean the flu.
Okay.
and it's most probably COVID if in case they develop any further infections in the winter.
Okay, doctor. How to prevent from acute and acute ear infection, doctor?
Okay. So acute ear infection again is very common during the winter months, and it is basically because of the nasal congestion. What is the structure of the nose and the ear is behind the nose there is a eustachian tube which connects the back of the nose to the middle ear. Its important function is to maintain the pressure in the middle ear. During the winter months what happens is the nose gets blocked, and if that is not treated or managed properly, the eustachian tube function kind of get impaired, and then you start collecting fluid in the ears. So the basic the primary goal is to actually prevent. So if you take care of the nose itself before it starts congesting, so you can prevent the ear infection. So in the beginning stages, in the first 2-3 days, steaming, over the counter medication is enough. But in case over a period of time, if it's not getting better, it's better you consult your local physician or your local ENT, take the appropriate medication. You may be advised nose drops. Again, there are two types of nose drops. One, sometimes you're advised this saline nasal drops, which are pretty harmless, but sometimes you're advised decongestant nasal drops. That is where you have to be a little alert. So the decongestant nasal drops, I don't want to mention the brands now.
Okay.
So when these are advised, they are not supposed to be used more than 3 days continuously. So that is where many people get into the habit of using these drops, and I have seen sometimes they've been using for 15 and 20 years, and it becomes a habit. It is, if you don't use it for more than 3 days, it is safe. But if you continuously use it, you kind of dependent on it, that is not a good thing.
Okay, doctor. Okay. So how do we suspect that we are affected from the ear infection, doctor?
Okay, so ear infection, generally what happens is during the winters your ears get blocked, and what comes and goes you don't have to be worried about. Your ears are blocked, you pop your ears, you're fine, nothing to worry. But suppose this the block is persistent, you're having continuous pain, and sometimes this pain will be actually more in the middle of the night, especially when you're lying down. And then what is happening is, why this happens when you're lying down, especially with young children, is when you're lying down, there is the lymphatic drainage is not, there is congestion, there is pooling of blood, and the lymph is not able to drain, and there is gives you a very severe pain. Sometimes what can happen, and you can also develop discharge. So this is the few signs of an acute ear infection. At that point, don't take any other medication other than a normal painkiller. What we generally advise is paracetamol, safest. Children can be given paracetamol drops, adults can take paracetamol tablets, and you can maybe keep some heat at the ears. Please don't use drops, because the first tendency is to put drops, because sometimes if there is an infection, you don't want you to use that, and immediately go to your physician or your ENT if possible.
Very useful information, doctor. Thank you. I'll go with my next question. That is, do ear infection go away on their own, or we need to do the treatment? Is that mandatory or what, doctor?
Very good question. Ear infections, especially viral infections, sometimes can go away on their own. So, but frequently what happens is they do progress, there is superadded bacterial infections, and then you definitely will require treatment.
Okay, doctor. And can ear infection be a sign of severe disease or what, doctor?
Again, a very interesting question. Can ear infections be a sign of a very severe disease?
Yeah.
So, ear infection sometimes can be a sign of, I don't want to, kind of alarm anybody,
Okay.
but sometimes these can be signs of some sort of malignancies in the upper airway. So, which is very rare, and it usually happens in adults and very, later. So this is a very unusual, this is not a very common thing that happens. So I don't want to, alarm anybody. So this is very rare, but sometimes, yes, it can be possible.
Okay, doctor. And what is the reason behind the nasal blocking, doctor?
Okay, so nasal blocking is, the structure of the nose is something like, you have the turbinates, which are actually boggy, spongy structures on either side of the nose, which have important function as to thermoregulate the air. And there is a septum in the middle. It's a dividing wall between the right side and the left side. During the winters, what happens is these turbinates, which are spongy structures on either side, which are filled with venous blood, to thermoregulate the air, because the outside air is cold and we need to kind of warm the air that is entering into the body. They become boggy. So when they become boggy and they become swollen, you feel a nasal congestion. So this is primarily the reason for a nasal congestion. Sometimes a nasal block. Sometimes if it is persistent and your sinuses get blocked, there may be infection. That may be the reason for your nasal block.
Okay, doctor. And do nasal polyps go away on their own, doctor?
Interesting question.
Yeah. Okay.
Okay. Do nasal polyps go away on their own? Sometimes yes, they do go away on their own. It's very, very rarely, but most often than not, no. You definitely need treatment, and those kind of nasal polyps that go away on their own are probably infective. So once the infection goes away, this also goes away. But if they're allergy, they're unlikely to go away on their own unless they are treated.
Okay, okay, fine, doctor. And does any medications is there, doctor, to boost our immunity?
Medication, as in, of course, you have vaccines. Vaccines are basically immune boosters. We mean you're priming your immune system to kind of boost it. So you instead of giving the pathogen, you are giving a part of the pathogen, which so that you prime the immune system to be able to fight it whenever there's an onslaught of the real pathogen, like the virus or the bacteria. Other things are basically, there is no medication other than sometimes we do give after surgeries where the requirement for healing is more, we do give vitamins and nutritional supplements so that you can heal and also have a good immunity.
Okay, okay, fine, doctor. And how to prevent from seasonal affective disorders by doing exercises or what, doctor?
Yes, seasonal affective disorders is a huge topic by itself.
Okay.
I don't think we suffer from that much in our part of the world, but the Western world does. Many people do suffer from that. So there are various ways, and actually nowadays there are technologies that are being used so that basically they don't see the sunlight, and that is the reason they ascribe to this. The diurnal cycle is change, and there's lack of melatonin secretion. So there are technologies that mimic the daylight, and that also helps in reducing the seasonal affective disorders. Exercise also definitely helps, and good nutrition again also helps, because vitamin D is also supposed to be a major role to play in seasonal affective disorders. So nutrition, exercise, and good interpersonal relationship. Technology now has opened. There's no geographical barriers. You may be sitting in the middle of in a small town in India, and you will be communicating with your loved ones across halfway across the world. So this can also help in kind of overcoming whatever mental stress or mental I won't say use the word disorders, but any kind of mental stress that may arise from this kind of problems.
Okay, doctor. And is physio will help in vertigo or cervicogenic headache, doctor?
Good question again. Vertigo again is in a huge. I hope we get some chance to do that one day. Vertigo is yes, in certain types of vertigo, yes, it does help. Physiotherapy does help in adapting the brain to the new normal, which is, I think, the new normal is becoming very commonly used. So if there is any injury to your balance mechanism, so the brain is not able to understand the new inputs. So physiotherapy does help in managing this. Yes.
Okay, doctor, fine. I was very happy with these answers. And we have some questions from our friends who are watching this session. That is, how will I know I am immune like that? This is from Latapati.
Okay, however, very interesting. So you can do, basically you can get some blood tests done to check how you're immune, if your hemoglobin is good, if your total count is good. So that shows that you're immune. And also there are, if your antibody levels are good, so when you check, that will also give you some indication.
Okay, okay, doctor. And one more question from Anusarthi. Why does my elderly aunt having a runny nose but she doesn't have cold?
Okay. I will need a little more information as to how long this running nose is, and what was the question again? My
Yeah,
aunt?
that is, why does my elderly aunt have a run nose but she doesn't have cold?
Okay. Actually, there is a condition called CSF rhinorrhea, where you actually the brain fluid may be coming into the nose and coming out. That is one possibility. If she doesn't have a cold, she just may be having some sort of secretomotor disorder also, or she may be having a chronic infection. So I think it is better you meet with your ENT or your local physician and definitely have a look into it if you've already not done that.
Okay, doctor, thank you. And one more question is there. How to measure immunity? This is from Raja Krishnan.
There is no actual measure of immunity, as in a quantitative analysis. I think Ms. Lata also asked the same question almost. There is no actual measure, but it's when you measure suppose if your hemoglobin is low, it's more likely that you'll be more prone to these kind of infections. So it's actually a wholesome analysis. If you measure all the parameters, you measure your hemoglobin, you measure your WBC count, you measure the thyroid, you measure other parameters, vitamin D levels, your urea creatinine. So all these measures, if they are functioning well, so you are immune. I mean, you have a good immunity levels. And even suppose, say for example, a person has undergone, say a transplant. So you're going to, that the patient is immunocompromised because they'll be using certain medication. There's no measure as such to measure what is your immunity level.
Okay, ma'am. And this question is from Narendra Chaudhary. How would I know if my cough or cold is serious enough to consider treatment?
Very, very important question. How do I know if my cough is serious enough to consider treatment? So if anything that is persisting for a long time, more than generally what we say a cutoff of about 3 weeks. So that is when I think we need to, you need to go and meet your physician. So generally for a cough and cold, 5 days, fever 7 days, and a cough is 3 weeks. Recently I had a patient who's been coughing for almost say 4-5 months on and off, and then we evaluated what was happening, and unfortunately the lady was suffering from a CA ovary. So these things can happen, so the cough may be a symptom of something else that is happening. So we definitely need to address it and evaluate it. So anything more than 3 weeks, please go and get it evaluated.
Okay, doctor, thank you. And how can I prevent my cold and cough? Or is there anything we can stop the coughing in cold weather? Anything is there, doctor?
Okay, how do I prevent the cold and cough? Actually, like I said, sometimes sneezing is actually a defense mechanism. The cough is actually a defense mechanism. So I do not usually give cough suppressants, so that because we want actually for you to bring out the phlegm and you kind of get it out. So we try to treat the underlying cause. If your cold or cough is because some underlying infection or allergy, so that once you treat the underlying cause, the cough and cold, or sometimes the cough may be because of reflux, acid secretion. So you have to go and meet your physician. You have to diagnose what the problem is and treat the underlying cause, or sometimes it can be asthma. So some coughs may be pure asthma. So you need to have a proper consultation and evaluation.
Okay, doctor. And you have shared your valuable information here. Thank you for that. And is there anything tips is there to follow throughout the winter season or in the summer season? Is there anything is there, doctor, to follow?
Yes,
Special tips.
so all throughout this, this is not only for the winters, this is for your day-to-day, normal day-to-day, now the new normal, of course. So we are living in the times of COVID. COVID, luckily, especially in our part of the state, is coming down because of lot of the government and or each and every individual is doing its own share in kind of preventing the spread of this. So what can we do to be be healthy? So a basic hand washing is very important. Wearing a mask, especially in public places, and washing that mask, if especially if it's a cloth mask, keeping that clean. And whenever you go back home, to keep your footwear outside. These are our traditional Indian practices, but this is also very important. So to keep the footwear out, to change the clothes, to have a shower, to keep your home well ventilated, clean, dust free. So and also have important a very a lifestyle, that is a routine, that you drink enough water. You don't have to think about it. If you form routines that are part of your life, drinking enough water, eating one vegetable or fruit in a day, or having less of stress, sleeping well, keeping your sleep hygiene, sleeping at a particular time, cutting off electronics at a particular time, getting up, having a routine for your exercise. So this becomes a part of your routine, so you don't even think about it. So once you're doing this, you can lead a very healthy and disease-free life. And another thing with regard to winters is important thing is some, of course we don't use heaters in winter in our part of the country, but in the northern part of the country people do use heaters.
Yes.
So when people do use heaters, I would request them to keep your room ventilated, because sometimes it may be carbon monoxide buildup that can happen during the winters, which is very there have been instances where it has proven fatal, either because of the fires or so be careful about that. So that was another tip I just remembered I needed to share.
Okay, doctor. Thank you, doctor, for sharing this valuable information on how to take care of ourselves in the new normal. And you have shared the special tips about the diet, breathing exercises, good sleep, and good interpersonal skill, and also the importance of vaccine. And you have shared some things. About the diet. It's like we have to include tomatoes, colorful fruits and vegetables, garlic, turmeric powder. It's very very useful, doctor. And also about the upper respiratory infection, breathing exercises, importance of steaming. That is also very very useful, doctor. And we'll definitely follow these things. And also about the importance of nutritious food. So everything was, we are happy with this answers. Thank you so much, doctor.
I thank you one and all. I hope I've answered all your questions. I'm sorry if we ran out of time. Please do send and we'll try to answer it. And thank you once again, Apollo Clinic, and all of you for joining us. Bye.
Friends, if you wish to consult Dr. Call, you can make a call to this number, that is 1860 500 or visit www.apolloclinic.com for appointments. Thank you.
Thank you.